This is Barry Selma speaking for Claim School Incorporated with another true crime story of insurance fraud. This one, video number 53, entitled Medicaid Paid Benefits to the Dead. Was this incompetence or fraud? The state of Indiana paid some $1.1 million in Medicaid-related payments in 2016 and 2017 to managed care organizations, MCOs, on behalf of beneficiaries who were dead, according to federal auditors reported by the United States Department of Justice. The audit, carried out by the Department of Health and Human Services Office of the Inspector General and released on February 13, 2020, revealed that in a random sample of 100 so-called capitation disbursements made to MCOs, the state of Indiana made 95 unallowable payments. The Office of the Attorney General found, quote, Indiana made capitation payments on behalf of deceased beneficiaries. We confirmed that 70 of the 71 beneficiaries associated with the 100 capitation payments in our stratified random sample were deceased. Of the 100 capitation payments, Indiana made 95 unallowable payments totaling $79,403. On the basis of our sample results, we estimated that Indiana made payments totaling at least $1.1 million to MCOs on behalf of deceased beneficiaries during our audit period, close quote. Indiana did not always fully process Medicaid beneficiaries' death information in the MMIS, although the state's agency's eligibility systems interfaced with federal and state data exchanges that identify dates of death. The state agency did not enter the dates of death in the MMIS for 48 of the government's sampled beneficiaries. Additionally, the state agency did not recover the capitation payments for 22 sampled beneficiaries that did have a date of death in the MMIS. The organization that received the unlawful payments are part of the Medicaid managed care health care delivery system. Medicaid agencies and managed care organizations that accept a set per member per month capitation payment for these services, the Medicaid program site states. MCOs use capitation payments to manage health care cost utilization and quality. The Office of the Attorney General concluded that the state agency made capitation payments on behalf of deceased beneficiaries. Aspects of the system have been plagued by problems, with the Indiana report coming on the heels of others that similarly found that some states had improperly paid capitation payments on behalf of the deceased. Similarly, an audit released in September of 2019 found that Illinois paid an estimated $4.6 million to MCOs to cover deceased Medicaid beneficiaries. Illinois Medicaid Administrator Doug Elwell acknowledged the findings in a written response to the audit and said state authorities would try to recover the improper payments and refund them to the federal government. No one in the federal government is holding their breath waiting for such funds. Similarly, Indiana Medicaid Director Allison Taylor said in a written response included in the audit that the state agreed with the conclusions of the report and will seek to recoup the payments. There are more than 71 million people currently covered under Medicaid. the social safety net program created 5 decades ago and expanded by President Barack Obama through the Affordable Care Act, commonly known as Obamacare. The Trump administration sought to reform the system, recently announced that it would test letting state Medicaid programs limit health benefits and prescription drug coverage for some patients in return for changing how federal government contributions to the states are made. The contracts between the state agency and the MCOs required compliance with the provisions in Indiana's Hoosier Health Wise and Healthy Indiana Plan MCE policies and procedures manual, which states that beneficiaries' enrollments will be terminated upon death and that payments to the MCO will be adjusted for retroactive enrollment of the beneficiaries. Obviously, dead people don't need health care or the work of doctors, and nor do they need any drugs. The state agency did not always process Medicaid beneficiaries' death information or recover capitation payments in the MMIS. When the state agency properly processes death information, the MMIS uses that information to identify a beneficiary as deceased, stop future capitation payments, and initiate the recovery process for capitation payments that were made after the beneficiary's month of death. The Office of the Attorney General recommended that Indiana refund $862,097 to the federal government, identify and recover unallowable payments made to MCOs during the audit period on behalf of deceased beneficiaries, which the government estimated to be at least $1.1 million, identify capitation payments made on behalf of deceased beneficiaries before and after the audit period, and repay the federal share of the amounts recovered, and finally ensure that the dates of death are added to the MMIS and that capitation payments made after the beneficiary's deaths are recovered. Dates of death were recorded in the MMIS for 22 of the 70 deceased beneficiaries. Nevertheless, the state agency made unallowable payments on behalf of these deceased beneficiaries. The state agency said it would conduct further research to determine why it did not recover the 27 capitation payments for these beneficiaries. That's not just Indiana and Illinois. The Office of the Attorney General estimated that in Michigan, the state made unallowable capitation payments totaling at least $39.9 million to managed care entities on behalf of deceased beneficiaries during the audit period. Of the 100 capitation payments made in the stratified random sample, and this is just a random sample, Michigan made 99 unallowable payments totaling $117,746. The unallowable payments occurred because Michigan did not always identify and process Medicaid beneficiaries' death information. Although Michigan's MMIS and eligibility systems interfaced with state and federal death files that identify dates of death, Michigan did not always identify those dates of death in the MMIS system, and the MMIS system and eligibility system did not share dates of death information with each other. Michigan also did not recover payments caused by dates of death not promptly identified in the MMIS system. The Office of the Attorney General recommended that Michigan refund $27.5 million to the federal government and identify and recover unallowable payments made to managed care entities during the audit period on behalf of deceased beneficiaries, which the Office of the Attorney General estimated to be at least $39.9 million, and identify capitation payments made on behalf of deceased beneficiaries before and after the audit period, and repay the federal share of amounts recovered. This audit report clearly shows that fraud is rampant in the country with regard to the Medicaid system. Obviously, Medicaid is designed to provide health care to impoverished individuals who can't pay for it themselves. Clearly, dead people can't pay for medical treatment, but they don't need it, and they can't receive it. They're 6 feet under. The question is it just Illinois, Indiana, and Michigan? Or is this happening in every state where they are just too darn lazy to check off people who died and stop paying for those services? This is insurance fraud on the government, and it needs more than a request for repayment. It needs to take the money away from those governmental entities that are wasting it. This video was adapted from my book, Insurance Fraud Costs Everyone, which is a supplement to my 2-volume treatise on insurance fraud called Insurance Fraud Second Edition, all of which are available from Amazon.com as Kindle books or paperbacks. Thank you for your attention.